Hello friends, I'm so glad you've joined me here. I'm Dr. Pamela Terrio, the author of Alleviate Dry Eye and the clinical director here at Sky Specialists. Today I want to tell you a quick story and then get on to learn something very important. So last week was fall break here in Louisiana. Lots of the schools had time off and I was able to go home to visit my parents. And my dad said, "Oh, can you come look at my eyes? They're red, they're watery, and I'm staring at the computer all day. By the end of the day, I just can't see anymore." And I said, "Oh, okay, Dad. I've never heard of this before." All you dry eye sufferers out there, you know what's wrong with my dad. He's a computer programmer, and he has been a computer programmer since before computers were even cool. Like before everybody was a computer programmer, my dad was like the original computer programmer. So he is, still works 40 hours a week and works hard and just stares at a screen all day long. So he's not blinking as much as he should be, and some dry eye symptoms are catching up with him. And so then he goes on to say, well, if they're dry, can I just put some Visine in them? And I'm ashamed to say this, but I yelled at him. I said, "Dad, no, you cannot put Visine in your eyes. Don't you listen to me? Don't you listen to my videos?" His answer to me was, "I don't watch Facebook." So this video is for my dad. We're going to go over exactly what he needs to do, and I'll tell you why this is important for all of you, and then I'm going to send it to him. So about 2 years ago in August, a very famous study was published called Tear Film and Ocular Surface Dry Eye Workshop 2 was published. So TFOS DEWS II was published into the world of eye care, and all of us eye doctors scrambled to understand the volume. It was like 400 pages. It was like a phone book. And what did it say about dry eye, and how is it helping us to get regimens in place for our patients that are easy to use? So what I have based my book Alleviate Dry Eye on is the stage 1 of what this study suggests to do to treat dry eye. Now stage 1, I wrote it down. The first step is to educate the dry eye treatment and management. So just tell patients about what their disease is and how they can best treat it. That would be chapter 1 of Alleviate Dry Eye. Number 2 is modify the environment. So sometimes your eyes are dry because you have a fan blowing in your face, and so you can turn the fan to the other side, or maybe you live in a dry climate like the Southwest where it doesn't rain very often, or Los Angeles like my dad does where it doesn't rain all summer long. So it's drier there right now than usual. So using a humidifier might help. So this can be found in my book in chapter 8. The final chapter goes over the seasons and how you might want to modify your environment for each season that you're in. The third recommendation from TFOS DEWS II was dietary modifications, and so that might include increasing your water intake or taking an omega-3 fatty acid supplement. Again, that's chapter 3 of Alleviate Dry Eye. Next is number 4, which is identify systemic and topical medications that could be exacerbating your symptoms. So there may be things that you are swallowing because they're prescribed for you, like antihistamines or hypertensive medications, anti-anxiety medications or antidepressants. All can cause dryness in your eyes. Birth control pills do as well. So tons of medications can do that. There is a complete list in chapter 2 of Alleviate Dry Eye. Then we go on to number 5 is tears. So using an artificial tear to augment the watery portion of your tears in your eyes. And then number 6 is doing some lid hygiene with lid scrubs and warm compresses. So when you come to see me in the clinic here at Sky Specialists, then I put you on a 4-step treatment process that you do at home. We try to educate you with take-home pamphlets and information about dry eye. Of course, I go over your medications when you're in the office, but then you go home with what we call, all of the doctors here at Lusk Eye Specialists, we do the same starter kit for dry eye patients. And so what does that include? I like to call it the 4 H's to help you alleviate your dry eye symptoms. So the first step is going to be hydrate. You're going to use an artificial tear like Refresh. Now, I usually recommend that patients use a preservative-free. Preservative-free are going to come in these little tubes that you break off and utilize, because you're going to put less chemicals and less toxins into your eyes. So hydrate with a preservative-free artificial tear. That is why, Dad, you can't use Visine. Number one, it's got preservatives in it, but number two, it also has a vasoconstrictor in it that's going to squeeze your blood vessels so that your eyes look less red, but the blood vessels are bringing nutrients to your eyes and you don't want to shut off that blood flow. Okay, so number one was hydrate. Number two is harmonize. So there are bacteria that live on our lids and lashes that are normal for us to have. Just like we have bacteria in our guts that help us digest our food, it is normal to have these bacteria on our eyes. At times, these bacteria can become overpopulated. One of the big causes is that when we're on our electronic devices, we're not blinking enough, and so our eyes aren't clearing sufficiently. So the bacteria can get overgrown, and you're going to use a cleanser to alleviate that overgrowth and reharmonize the bacterial content on your eyes. So I've got a couple of different ones here in front of me. The most common one that we prescribe is this hypochlor. It's hypochlorous acid, which is an antiseptic, so it's not actually killing the bacteria, but it's removing the excess of them. And this is easy to use twice a day. You close your eyelids, squirt, squirt. It's a spray. Just rub with your fingertips right into your lashes. For people who have itchy eyelids, like right at the base of the lashes, it really itches, then we often will recommend a tea tree oil based cleanser like Blefadex. We have this one in the office. Or We Love Eyes. This also has a tea tree oil in the lid scrub, and so it's great to use if you have that extra itching at the base of the lashes or the margins of your lids are significantly red. You're going to want to use a scrub. Again, same thing, just a small pump on the end of the tip of the finger, rub them together and right across here. And personally, I use We Love Eyes because I also wear makeup, and I love We Love Eyes, their makeup remover, which is oil-based. If you want to give this a try, you can find it on my website at www.pamterrio.com. In the iStore, there you will find the We Love Eyes makeup remover oil and lid scrub. It comes together as a kit. It's under the beauty drop down. Okay, so next step, so step one, hydrate. Step two, we're going to harmonize with a lid scrub. Then we are going to heat our eyes. So step three is heating. This is called a Bruder mask. It's a beaded mask that you pop in the microwave for about 20 seconds, and then you lay it over your eyes for as long as it'll stay warm, which is 8 to 12 minutes usually. This is going to melt the oils that are in our lids that are there. They should be flowing every time we blink, but again, because of our electronic devices, we're not blinking as much as we should be, and these oils can get backed up into the lids. So heating them will help to release the oils back into your tear film so that your eye will be more comfortable. Okay, that was step three, is heat, and step four now is heal. So we want to heal our dry eye. And what does that mean? Dry eye is exacerbated or run by inflammation. So we want to remove the inflammation from our bodies, and one way of doing that is to use an omega-3 fatty acid supplement like this one. This is called Dry Eye Omega Benefits by Physicians Recommended Nutraceuticals. I also like Hydro Eye by Science Based Health. They will both have controlled studies that have proven to bring down the inflammation on the eye with these formulations. So you're not going to want to just run off to Walgreens or Walmart and grab an omega-3 fatty acid or fish oil supplement from the counter. You really want to get a medical grade one from your eye doctor, or again on my website you can purchase that. So the 4 pillars to dry eye treatment that you can do at home are to hydrate with your preservative-free, artificial tears. Number 2, harmonize with that lid cleansing spray. This is the Hypochlor. 3 is heat with a warm compress. And 4 is to heal with an anti-inflammatory, such as Hydro Eye or Dry Eye Omega Benefits. So there you have it. It's scientifically research proven from the Tear Film and Ocular Surface Society DEWS II Dry Eye Workshop. Came up with this stage 1. It's all things that you can do at home to continue on your dry eye healing. If stage 1 doesn't take care of your symptoms, your eye doctor can recommend in-office procedures to elevate your dry eye treatment through medications or, like I said, in-office procedures. This is only stage 1 of 4 stages. So there's lots of other treatments for dry eye, but most eye doctors will still recommend that you do these 4 basics even when you've moved on to another level. This kind of sets the stage. It's a good foundation for your dry eye treatment. So I really appreciate that you're hang in there with me today and watch this video, because there is just so much good information on how you can help to alleviate your dry eye symptoms with this 4-step process. It's the process that I put all of my patients on when they come to see me in the clinic, and it's also the process that I recommend in my book, Alleviate Dry Eye. So again, thank you for indulging me in this video today, and I hope you'll share it with a friend who's struggling with their dry eyes. And I will catch you next week for another video. Please don't let your dry, red, itchy, irritated eyes hold you back from doing the things you love in life. You deserve clear, comfortable vision, and there's a way to get it. Just keep watching my videos, and I hope to share all the secrets with you. Thanks again.